I'm Nurse Cundiff. I'm going to be your nurse today. Let me wash my hands, make sure the area is safe for you and I, pull the curtain to provide privacy, and then can I see your wristband? Wash my hands for 20 seconds. Can you tell me your name and date of birth?
Jane Doe 1397.
It's exactly what this says. So, Miss Doe, are you comfortable?
Yes.
I'm going to do a head-to-toe assessment. It's going to take about 15 minutes. Okay, so let's start with, can you tell me where you are?
Rasmussen Hospital.
And what's the month?
March
What's the year?
2022.
Who's the president?
Biden.
And why are you here?
I sprained my ankle.
Okay, so her voice is strong and clear. There's no slurred speech, no mumbling, no word searching. Her head is normocephalic. Her face is symmetrical. Have you bumped your head lately?
No.
Okay, I'm just going to touch your head. No lumps, bumps, lesions noted. Hair is evenly distributed, and there's no parasites noted. Okay. So, can you turn toward me a little bit? Okay. Her posture is upright and her hygiene is clean. Thank you. Okay, so have you had any trouble smelling with your sense of smell? Any change? Okay, so her nose is midline. Can you tip your head back a little bit? Okay, good. You can put your head forward. So the nasal septum is midline. The nares are pink and moist. No excessive redness or drainage noted. Can you cover one nair and sniff? And the other one? Nares are patent bilaterally. And you said no change, and cranial nerve number 1 is intact. Let me tap here. Do you have any tenderness here? No frontal or maxillary tenderness. That's good. Have you had any change in your vision? Blurry vision, double vision, halos around lights. Okay, so her eyes are symmetrical. They're about 6 millimeters and round, the pupils 6 millimeters and round. No redness, no drainage, no swelling noted. Eyelashes and eyebrows, hair is evenly distributed. I'm just going to pull your lower conjunctival sac down a little bit. There you go. Thank you. No redness, drainage, foreign objects noted. Sclera is white. So if you would look at my nose, I'm going to shine bright light in your eyes. Okay, and then follow my fingers. Okay, pupils are equal round, reactive to light and accommodation. Can you turn that way for me? Okay, I'm going to check your peripheral vision. Okay, so you look straight and tell me when you see my hands.
Yes. Yes. Yes.
Okay, peripheral vision is intact. So you're standing 20 feet from the Snellen chart. Can you cover one eye and read the bottom line?
A, B, C, D, E, F, G.
Okay, that's good. Cover the other eye.
A, B, C, D, E, F, G.
That's good. Read them with both eyes.
A, B, C, D, E, F, G.
Okay, your vision is 20/40. That means you have to stand at 20 feet to see what a person without any visual disturbance can see from 40 feet. Okay, cranial nerve number 2 is intact. Okay, so now I want you to one more time follow my fingers. Don't move your head, just your eyes. Okay, the eyes move symmetrically with no nystagmus. Cranial nerves 3, 4, and 6 are intact. I want you to close your eyes. I'm going to touch your face. You tell me where I'm touching.
Forehead, chin, cheek, cheek.
Okay, good. And then smile real big, frown, raise your eyebrows, lower your eyebrows, puff out your cheeks. Okay, clench your jaw real tight. Don't let me open it. Okay, cranial nerves 5 and 7 are intact. Have you had any change in your sense of hearing?
No.
Okay, this way. With pen light. Here it is. Too many pockets. Okay. I'll pull up on your pinna. No redness, drainage, or excess cerumen noted. No redness, drainage, or excess cerumen noted. Is this tender at all?
No.
How about this?
No.
Okay, no tenderness in the pinna or tragus. I'm gonna make a noise next to your ear. You tell me which side you hear it on.
Left. Right. Oh.
Okay? Cranial nerve number 8 is intact. Have you had any trouble with swallowing?
No.
Okay, I'm just gonna put my hand right here. Do a big swallow. Okay, swallow is strong and equal bilaterally. Okay, turn around, try me again. Okay, so stick out your tongue for me. Say ah.
Ah.
Okay, one more time.
Ah.
Okay, good. Okay, so the lips are pink and moist, no lesions noted. The teeth are intact and in appropriate repair. The gums are pink and moist, no lesions, no discoloration, no bleeding. The oral mucous membrane is pink and intact without any lesions. The tongue is pink and moist, appropriately rough, no lesions. The tonsils are 2+ and red, but no exudate noted. The uvula is midline and rises with phonation. Can you stick your tongue out, move it left, right, up, down? Okay, so cranial nerve number 9, 10, and 12 are intact. Okay, that way again, thank you. Okay, lift up your shoulders for me. Turn your head into my hand. Okay, turn your head into my hand. All right, cranial nerve number 11 is intact. Now I'm gonna check your lymph nodes. Tell me if any of these are tender. Submental, submandibular, pre-auricular, post-auricular, tonsillar, anterior cervical, posterior cervical, occipital, and supraclavicular. Any of those tender? Okay. Now I'm going to listen to your heart and lungs. Okay. So, okay. We'll start with, thank you, ma'am. Start with your aortic valve, second intercostal space, right sternal border. This is where I hear S2 the loudest. Pulmonic valve, second intercostal space, left sternal border. Erb's point, third intercostal space. This is not a valve, but this is where I hear S1 and S2 equally. Tricuspid valve, fourth intercostal space, left sternal border. And this would be stethoscope on skin. Mitral valve, fifth intercostal space, mid-clavicular line. That's where I hear S1 the loudest. S1, S2 heard, no murmurs or extra heart sounds noted. Okay, so now I'm gonna listen to your lungs. I want you to take a big deep breath through your wide open mouth. Okay, one more time. I'm gonna be listening for the full inspiration and expiration. Don't be concerned, I'm just doing a real thorough job. Okay, now you can breathe normally. I'm just gonna show my professor where I'd listen. And this would be stethoscope on skin for the whole time. I can get one more spot right in here if I displace the breast tissue. Okay, now I'm gonna listen under here, stethoscope on skin. Anterior lung sounds are clear throughout. Now I'm gonna listen under here. This one's clear, so I'm gonna listen right here. Okay, mid-axillary breath sounds are clear on the right. And then, okay, mid-axillary lung sounds are clear throughout. Can you turn around for me? Oh, very good. Thank you. Okay, so are you dizzy at all from all that deep breathing? No? Okay. So big deep breath in and out. Apex of the lungs. Okay, now breathe normally. I'm just going to show where else I would listen. So I'm going to hear around the scapula and comparing side to side. Okay, posterior breath sounds are clear. Okay, can you say 99 for me?
99.
Okay, tactile frummatus is equal throughout. Can you take a big deep breath for me? Thoracic expansion is equal bilaterally. Spine is straight. I'm gonna check your kidneys here. You tell me if they're tender at all. No costovertebral angle tenderness. Okay, good, turn around. I'm gonna do those over there. Okay, so, next we're gonna check your reflexes. I got a plan. But I appreciate you. Okay.
Following the face.
I know. Okay, triceps reflex. Good down here a little bit more. Okay, triceps reflex intact bilaterally. Okay. Okay. You like so. You're good. Okay, biceps reflex intact bilaterally. Okay. I'm gonna try that one more time. Okay, brachioradialis intact bilaterally. Do you feel that one a little bit? Okay, so come over here and sit on the table for me, please. Okay, so put your hands together like this and pull. Palpate the patella. Palpate the patella. Okay. Patella reflex intact bilaterally. Okay, come put one of your knees on that chair. Okay. Achilles tendon reflex. Can you put your knee more forward? Yep, just like that. Intact bilaterally. And then put both your feet up here. Okay. Here we go. Plantar reflex. Intact bilaterally. Okay. So now we're gonna do some range of motion checks. So can you stand up for me? Put your feet right together, arms by your side, close your eyes. 20 seconds. Okay, Romberg's test is negative. You can open your eyes. Okay, now face me. Okay, can you touch your chin to your chest? Okay, look straight. Put your head back. Turn your head to the left. Turn your head to the right. Put your left ear to your left shoulder, right ear to right shoulder. Okay, can you do a big circle with your arms? Okay, give yourself a hug. Put your arms in the back. Make a big circle with your leg. Here, you can hold on to the chair if you want. Okay? Okay, good. So, range of motion in the neck, arms, and legs is intact. Can you put your arms up like this for me? Okay, I'm gonna push you, resist. I'm gonna pull you, resist. Okay? Sit down for me. Okay, I'm gonna push you, resist. I'm gonna pull you, resist. Okay, strength is 5 out of 5 in the upper and lower extremities. Okay, so can you do a little walk, like make a little circle and go over to the table? Go right over there and hop up on the table. Okay, gait is, I think you need to be over there. Otherwise you're just gonna get my big old butt. Gait is balanced and steady. Okay, with no stumbling or limping noted. Abdomen is flat and non-distended. I'm gonna listen to your vowel sounds. Starting in right lower quadrant. Vowel sounds are active in all quadrants. Do you have any tenderness in your abdomen? Okay. Okay, abdomen is soft, non-tender, non-distended. When was your last bowel movement?
About an hour ago.
Was it formed in brown?
Yes.
When was the last time you urinated?
About an hour ago.
Was it clear or amber?
Clear.
Clear. Any burning frequency or urgency?
No.
Okay, good. So now I'm going to check your limbs for lesions, tenderness, and edema. No lesions, tenderness, edema. Now I'm going to check them for temperature. Temperature is consistent throughout her body. Now I'm going to check your pulses. Carotid pulse, 2+/4+, 2+/4+. Brachial pulse, 2+/4+ bilaterally. Radial pulse, 3+/4+ bilaterally. Popliteal pulse, 2+/4+ bilaterally. Posterior tibial, 2+/4+ bilaterally, and dorsalis pedis, 2+/4+ bilaterally. I'm checking the capillary refill in your toes, brisk less than 2 seconds, and in your hands, brisk less than 2 seconds. Okay, I'm gonna help you up. Okay, you go over here. Okay, go ahead and have a seat. So let me think. I did cranial nerves, lump down, heart sounds, lung sounds, belly sounds, range of motion, gait, abdomen. I think we're done.
I didn't hear you, I guess.
Okay. Okay, Ms. Dill, do you have any questions?
No.
Here's your personal belongings. Here is your nurse light. I'm gonna be back to check on you in about an hour. If you need anything before that, just push the light. One of us will be happy to help you. Would you like your door open or shut?
Closed.
Closed, okay? I'm gonna wash my hands, 20 seconds. Close the door with my foot. Document my findings. Thank you, Miss Doe.